to continue on that health threat with a CBS News investigation that reveals the coronavirus has been especially deadly for one of America's most vulnerable populations. That's people in nursing homes. In a disturbing new development, we're learning an overwhelmed facility in New Jersey put 17 bodies in a morgue that was only big enough for 4. Jonathan Vigliani reports on these nationwide concerns.
The Canterbury Rehabilitation and Healthcare Center in Richmond, Virginia, is one of the hardest hit facilities in the country. Medical Director Jim Wright has lost 45 residents.
We have been fighting a battle with COVID-19 for the past month now, and it is a battle that at times we feel we're losing.
It's a grim scene repeated across the nation, prompting governors in several states, including Massachusetts and Florida, to deploy the National Guard to run tests. Experts say the lack of mandatory testing for residents and employees, staffing issues, and a shortage of personal protective equipment are the biggest problems. Nurse Sherry Martinez asked us not to identify the California nursing facility where she works.
One of the things that I've been doing is getting garbage bags and putting them over my arms.
Federal officials are also facing criticism for not publicly tracking infections and deaths in these facilities. We reached out to every state, but only got complete data from 19. We also included county data and information from facilities themselves. Officials confirmed more than 35,000 seniors and staff have tested positive. More than 5,700 have died.
It sounds like our most vulnerable, the elderly, are sitting ducks in these facilities.
They are. People who work there are the most underpaid. I used to call the ugly stepsisters of the healthcare industry because we don't pay enough attention. We don't pay the nurses' aides enough.
Some employees, presumably fearing for their own safety, are refusing to come to work. Last week at the Magnolia Rehabilitation and Nursing Center in Riverside, California, only one nursing assistant showed up, forcing the county to evacuate 84 residents. Donna Reno's husband, Don, was a patient there.
Ambulances lined up, ready to, take everyone out and, get them out of that facility.
Don Reno tested positive and is now running a fever.
But just have to hang in there and, hopefully everything will be good for everybody.
And Reno tells me after her husband was evacuated from this facility, it actually took her more than a day to locate him. She had to call the police department. The Centers for Medicare and Medicaid, which oversees nursing homes, says it is now working with the CDC to increase reporting, but how they will do so and what numbers will be made public at this point unclear. Meanwhile, Anthony, we will continue to make those calls state by state.
All right, Jonathan, thank you.